everybody. This is your inspirational nurse, and I am Tiara coming to you live with another What Would You Do nurse series for this week. I hope you guys are having an awesome summer so far. I know where I'm at, it is hot. So y'all need to stay cool and don't forget to drink your water. So I have another awesome video of what you would do. Now, guys, everything that I'm going to share on this nurse series is going to be things I actually experienced as a travel nurse or a new nurse still, or this is just like all my years of experience of things that I experienced. And at the time, I was still processing what I experienced and probably never really had closure to a lot of the things that I've been through, guys, and seen and experienced. And so I am now doing a nurse series on things I actually experienced on the floor and want to know what would you do in this situation. And it's meant to shine light on situations that happens. It's meant to educate. It's meant to bring humor. It's not meant to offend anybody. These are actually things that I went through, and I just want to shine light on some things like this that is happening because, as you know, nursing is just very unique. It is an art and science. There's things that is going on. There's system issues. There's so much things going on in this imperfect healthcare system. So let's talk about what would you do. Now, guys, what would you do if a nurse comes to you directly and says, hey, I have this patient and I need to get back onto the bed. He's a little heavy, I just need help. I need 2 sets of hands. You have a little bit of time to come by my room real quick. He's sitting by the bedside. And you in your mind thinking, okay, sure, I would love to help you. Let me meet you in the room so we can get the patient back on the bed. And in my mind, I'm thinking we're getting ready to do some ADL care. Maybe this patient is incontinent. Maybe this patient, there's something that she needs to do and she needs another set of hands. So, guys, upon entering the room, I remember walking into the room first and she was behind me. And I remember seeing the patient sitting by the bed, y'all. And when I walked in the room, I could not believe what I was seeing. The patient literally was dead in the chair. And I remember she was so adamant of, we got to come on, lift him up so we could get him in the bed. And I'm looking at her like literally the patient was so cold to touch, gray, stiff, no signs of life, guys. Now, I remember just being in shock because she was still so adamant that this patient was alive, that we need to get this patient on the bed. And I remember just like, girl, this patient is dead. I so remember that. And oh my God, guys, I was on this travel assignment that I would never forget because this was a place that it was just strange. They had a lot of death. I mean, a couple of patients would code a day. A long list of patients would be coding. Lots of deaths. They had no resources. These poor nurses had no phlebotomist, no transportation team, no RRT team. They were the RRT team. And I remember just telling my husband, like, this is just too many. So I remember just being like, this is just strange that they having a lot of colds, a lot of deaths I'm seeing. And usually sometimes it could be if the quality definitely drops. Sometimes this can be happening. Patients are not really having good outcomes. They're not surviving, right? So y'all, and when she looked at me, she could not believe. She was like, what are you even talking about? Patient. Oh my gosh, I guess the nurse was so hyper focused on things because again, every hospital has different resources. Some hospitals and some facilities I've been to have nothing, guys. I literally pray for those nurses the whole time because I felt so terrible that they had no resources on this unit. They have no help. If your patient had to go to surgery, you had to take the patient to surgery. Go get them. If it was a code, every time you come in, you get assigned a role in what you would do in the code. Maybe you are compressions, which they kept me on compressions. Maybe because I was just a travel nurse. It's all good because I sweat my hair out. That is fine with me. And I remember, guys, literally, she still called the RRT team like, oh my God, my patient is dead. Start panicking. She tried to call for help. I'm sorry, not the RRT because they didn't have one, but she called everybody. We were the RRT team, guys. That's why on this nursing assignment, you had to have your ACLS. Literally, they wanted to see that you were able to run codes, and now I see why. And she was calling people in the room trying to get this patient back on the bed, and we're trying to put the patient on the bed for her. And I remember everybody coming by the bedside and just looking like this patient is dead. And, people just standing there on, the patient literally had no signs of life, guys. This patient was very, very cold, very stiff. And in my mind, I'm just trying to process, like, what happened, and I know in this unit, we had a lot of patients. I want to say the ratio was probably 1 to 6. It was an LTAC unit. LTAC patients are usually coming from their ICU units and they come to the LTAC unit. They usually have very extensive wounds on the types of nursing. If you haven't done LTAC, I started in LTAC, which I feel like if you started LTAC, you gonna be awesome, because let me tell you, you learn your lines, your drains, your vents, all your devices. You learn your trachs, all your stuff, all your major devices and things like that. But these patients usually have several mobilities, comorbidities. They usually have extensive history of things, and they're very sick. And they usually come from the ICU and go to your LTAC units. And this is where you would do a lot of big pain management. You'd be big on pain management, lots of Dilaudid, lots of all your heavy narcotics, because these patients would be in agony, right? And let me tell y'all, this unit, these patients was passing away so fast. I was just in my mind trying to investigate, like, what am I missing? What are we missing? What's going on? Is there a system problem? What's going on? And staffing, of course, is a challenge. But I'm just, like, looking at this nurse like, what, how? And because she was just so adamant that because the nurse was still so adamant on that her patient was not bad. She just couldn't believe, like, how did she not see that the patient passed away? And sometimes as nurses, if you're not set up for success and you're just basically in survival mode and you're so hyper-focused, there's things you can miss when you are, some things that's obvious to other people may not be obvious to you, because you're just ripping and running, trying to get tasks done, trying to get through your day, trying to get your meds passed. So sometimes I didn't judge the nurse off of this. It was more so, okay, how long has this patient been down? How long has this patient been dead in the chair, and how come there's so much death here? So the death rates were definitely high. I definitely had the opportunity here to get with the management there, and they actually asked me to manage after, because I was working on my bachelor's of nursing project there, and the manager took me under her wing, and we were working on, she was trying to improve a lot of areas and on the unit for the nurses, and want to know my advice about helping drips and helping nurses to, so patients have good outcomes, and, they don't bleed out, and wanted my advice on their drips and things that they were doing on the unit. But some units, guys, is so far gone, so sometimes it's really hard to, come onto a unit, and if you're thinking about going to management, and like maybe you're like, is this going to be a great first start if I'm still a novice in management? Maybe I'm still learning, I'm a baby in this. What would be a good first management type of facility or a team that would be great for my first time experience, So I declined, and but yeah, we still supported the nurse. We still was there. Of course, there was some questions. Of course, we was trying to figure out what, how long this patient's been down. The patient looked very, very stiff, and it was just a lot to process. I remember just being like, oh, wow, okay, so what do we do next, How can we prevent this from happening next time? I'm more like, how can we prevent? And I'm all about your systems and your structure of the unit. It has to be set up for the nurses to succeed. Now, guys, you can have a very few nurses and still have an amazing, amazing unit. Now, I've been places where they have bare to minimum resources and they have a little bit of staff, but they are amazing. They have like a full structure, full processes and things that they do uniquely to still be effective in what you do as a nurse. Some things are still unexcusable. As far as what the mistakes you made and things that you missed, some things you have to hold yourself accountable for as a nurse in order to grow. Everything can't get blamed on healthcare and, someone not doing something or providing you with something. When you sign up for a particular job, you are signing up to say that I am capable and competent to do this job. So don't sign up for nothing if you ain't ready to take on the challenge. So don't sign up to nothing if you're not ready to handle things that might be really extremely challenging for you. You definitely have to be honest with where you are in nursing as far as what you're capable of getting done, your skills, and what you're capable of taking on. As you start to mature in your role, you will definitely make better decisions in job choices and different types of units and different types of, if you're a traveler, contracts that you would not take and things you would. You definitely would start to do more homework on either ways to find solutions so this is not missed or happen to you or any other nurse again. So you would definitely start to dive deep if you really love nursing. Like, I love nursing, guys. I could do it with my eyes closed. I could do it all day, 24 hours a day, honey. If I ain't had to come home to my kids, baby, I would be working. But this was definitely my highest paying contract, and it was definitely a eye-opener to other nurses not having resources, not even a phlebotomist. They were in charge of everything, guys, on this unit. You had to do everything for your patient. There was a lot of travelers there. I remember meeting so many respiratory travelers and just different people from all over the world coming to travel there. And there was a big main hospital in the area. So, it was just unfortunate that this happened, and it does. The educational piece here would be to round. You have to make sure that you are rounding your hourly rounds. Sometimes I round hourly, or every 30 minutes. It depends on what the patient has going on. If they have certain special circumstances behind closed doors that nobody knows about, I definitely would be rounding very, very often. I think, and nurses used to laugh at me all the time, like, girl, you don't sit down. No, because there's always something going on. I remember working night shift and those nurses be like, girl, what's going on? I was checking every room. I'm going through every door. I'm listening. And one night it was somebody saying help, and they was really coding. Like the patient was coding at night, and people were like, how did you hear that? So we have to stay vigilant. You can't get lazy in nursing to the point where you feel like, and even if you're on a travel assignment, you're like, oh, my patient good. I'm working general. I'm working LTAC. I'm not in like a critical care setting. You don't have to always be in a critical care setting for something critical to happen. You do want to catch it, like, so if the patient was passing, and catch it, so you can be able to answer questions. So if the families have questions for this patient that passed, what can you really say? What details can you really give them about how they passed or whatever, right? So you want to not get lazy. That is my point in all of this. That's what I would do, is be more rounding, more checking your lines and drains. There's times I check things, and I remember one of my surgical patients was taking all the surgical drains off, and like, I got it, I know what to do. And like, patients sometimes do some weird things and they don't tell you. I have been in some unique situations. That's why I started this nurse series, to shine light on things that I actually experienced as a nurse on the floor. And I want to know, what would you do if you was in a situation with someone new? Now, some people thought that the nurse knew, like, her patient was like dead and was just trying to get me to get the patient like to the bed, and maybe, I don't know, but I really just think that it could be something that was really missed. Because if you're somewhere that have no resources, and you're literally ripping and running, your focus is not on the small details. Is on like, oh, let me get through these tasks, let me get through blood sugars, let me get through vitals, let me get through, let me get all my meds, let me get through, this patient has some tests to go to. It just never, you just never know. But what would you do, y'all? You know what I'm saying? You come on to shift and someone asks you to lift their dead patient out of a chair to the bed, and they are extremely dead. What would you do? Because I find like nursing is always a trend of something that you either witness, that God wants you to witness, or you always wind up in a certain situation with certain patients, and you always. Now, some people thought that the nurse knew, like, her patient was like dead and was just trying to get me to get the patient like to the bed, and maybe, I don't know, but I really just think that it could be something that was really missed. Because if you're somewhere that have no resources, and you're literally ripping and running, your focus is not on the small details. Is on like, oh, let me get through these tasks, let me get through blood sugars, let me get through vitals, let me get through, let me get all my meds, let me get through, this patient has some tests to go to. It just never, you just never know. But what would you do, y'all? You know what I'm saying? You come on to shift and someone asks you to lift their dead patient out of a chair to the bed, and they are extremely dead. What would you do? Because I find like nursing is always a trend of something that you either witness, that God wants you to witness, or you always wind up in a certain situation with certain patients, and you always.